So yes, I'm coming from the Yale School of Medicine. So chronic inflammation is often cited as the etiology for increased risk of age-related diseases in the setting of HIV infection. However, the mechanisms that link inflammation to this increased risk are not fully elucidated. And in this study, we're going to focus on the NLRP3 inflammasome, which has been strongly linked to the development of age-related diseases. So here, the inflammasome is an intracellular protein complex that can form in response to many different signals, both microbial and damage associated. But the end result is the cleavage and activation of caspase-1, pro-IL-1 beta, IL-1 beta, and IL-18. So we set out to recruit young and older HIV negative and HIV positive adults. We collected their clinical characteristics, and we can talk in more detail. We enrolled a total of 100 subjects. We isolated their PBMCs for all studies, and the older STAR cohort was recruited to better match the HIV older cohort. Here we see at baseline that we had elevated levels of activated caspase-1 with older adults, with and without HIV, and with comorbid conditions. At baseline, we saw higher levels of cytokine levels, IL-1 beta, IL-18, IL-6, interferon beta in the older cohorts, the HIV older cohort. The lowest levels were seen in the HIV negative young cohort with the smallest blue area. With stimulation, we see a dampened ability to respond in the older cohorts, whereas the young HIV negative cohort had the largest ability to respond in blue. We then purified monocytes and then RNA-seq analysis, and pathway analysis shows a very strong interferon signature at baseline with both HIV infection and aging. With stimulation, we see a downregulation of these signatures. Interestingly, we saw a downregulation of TLR4 signaling that was specific to the HIV older group that deserves further investigation. And finally, when we did weighted gene co-expression analysis, we saw increase in this blue module that deserves further investigation, but the blue module, interestingly, had signatures of neuronal signaling, PD-1 signaling, complement. Let's talk more later. Thank you for your time.